The search for an acceptable electrophysiological addiction treatment has come far. Comment by Lorne Patterson and Myrrh Winston. Lorne Patterson is a British psychiatric nurse living in Ireland. He provided remote support for a US clinical trial of a neuromodulator device for opioid use disorder. Myrrh Winston is an emergency department nurse in the US and clinical trial manager for the same study. This podcast is produced using an automated voice, so some of the words and phrases may not be as you would usually expect to hear them. Disclosure: both authors have ongoing involvement with the private healthcare company whose device underwent blinded investigation in the study paper. From Frankenstein, or the modern Prometheus, Mary Shelley's Gothic classic of an overreaching science inspired by Aldini's fantastical public reanimation experiments of the early 19th century, to rigorous clinical trials for a non-chemical approach to managed opioid withdrawal in 2022, the search for an acceptable electrophysiological addiction treatment has come far. The underlying principle of therapeutic electrostimulation, if only dimly understood by its early pioneers, such as Luigi Galvani and his nephew Giovanni Aldini, who sought to treat contemporary mental illnesses with galvanic stimulation, non-invasive electrical stimulation of the nerves via electrodes applied directly on the skin, is that an electrically functioning body should respond equally well to electrical remedies as to chemical interventions. This hypothesis holds firm 2 centuries later, even if the journey towards serious scientific and clinical consideration has been fraught and frequently controversial, not least when psychiatrist Peter Roper of the Allen Memorial Institute of Psychiatry, McGill University, Montreal, claimed electroconvulsive therapy, ECT, to be one of the most effective techniques of changing psychotic behavior, after proposing intensive ECT should be considered in drug addicts with an otherwise poor prognosis. According to Roper, the de-patterning, disorientation, re-patterning sleep and shock technique, developed by psychiatrist Professor Ewan Cameron of McGill University in the 1950s, made ECT an appropriate clinical intervention for preventing relapse in what he called the irrational behavior of drug addiction, now designated as substance use disorder. Already notorious, ECT, electroshock in America, became even more so when the unethical use of sleep and shock in medical brainwashing experiments and its funding by the CIA was finally revealed. Roper and Cameron's re-patterning advocacy was discredited, and ECT, though eventually approved in much modified form for severe depression, never became an accepted addiction treatment. Dr. Robert Heath, head of the Department of Psychiatry and Neurology at Tulane University, Louisiana, and an early pioneer of what would come to be known and regulatorily approved as deep brain stimulation, DBS, generated similar public revulsion. His research in the 1950s and 60s into the use of implanted electrical stimulation of the brain's pleasure areas to treat a range of treatment-resistant psychiatric conditions, primarily schizophrenia, but also homosexuality and drug addiction, which he described as a neurological defect, also failed to survive public exposure. Even in the social context of attitudes of the era, which were disturbingly casual, Heath's boundary pushing was deemed unethical by many, although also courageous and determined by some. If such extreme applications left enduring skepticism, more cautious and considered experimental use of electrostimulation, as well as increased regulatory oversight, began to establish sound scientific, clinical, and ethical foundations. Out of these foundations, technological advances and clinical innovation pushed forward a range of diagnostic and treatment possibilities, while scientific research began to elucidate the mechanisms involved in targeted electrostimulation, including those impacting on underlying intrinsic pleasure, pain control, and dependency processes. An early use of non-shock electrostimulation as an intervention for addiction came in 1973, when Hong Kong neurosurgeon Dr. Shanglai Wen suggested his investigation of electroacupuncture analgesia showed the approach might also have the potential to reduce opiate withdrawal suffering and craving in surgical patients with an opiate dependency. Wen reported that electroacupuncture stimulation would, after 15 to 20 minutes, consistently result in drying of the eyes and mouth, decrease in shivering, and reduction in both reported and observable anxiety. Similarly, use of Professor Aimé Limoges' electroanesthesia device, which had reduced the amount of opiates required in surgery in France, was subsequently investigated for its potential for reducing heroin withdrawals. By 1987, having treated over 500 heroin users, the Bordeaux doctors reported favorably, after about 50 hours stimulation, a naloxone test produced little or no reaction in the patients. In the US, an early blinded clinical trial of cerebral electrotherapy, CET, to support methadone-assisted withdrawal from heroin, likewise reported positively. 9 of the patients receiving active CET were drug-free by the end of 8 to 10 days, and all experienced a marked reduction of their symptoms. The control group did not show significant changes. In 2018, America's Food and Drug Administration stated that medical devices have a unique and important role in tackling the nation's opioid crisis. By 2022, 3 randomized clinical trials of electrostimulators for opioid use disorder were listed in clinicaltrial.gov, including a study with which these authors are involved, since deemed by the FDA to be a pivotal investigation of neuromodulation for opioid use disorder. These scientifically rigorous investigations are intended to definitively answer the vexed question of whether this distinctive approach for opioid use disorder is safe and efficacious. To access this full article with references, visit nursingtimes.net and search under the mental health topic. There you'll find a wealth of resources, including Ask Nursing Times, our AI search engine, which provides you with instant answers from more than 6,000 double-blind peer-reviewed clinical practice articles, plus news, features, opinion, and more, with links for further reading to support your continuing professional development and revalidation requirements. We hope you have enjoyed this podcast and thank you for listening.